morning, everyone. My name is Yahui. So today I'm going to present you about the nutritional assessment in prevention and management of obesity. So my presentation will explore the obesity prevalence and trends in the world drawn from recent research and data. We will also discuss the importance and impact of nutritional assessment to prevent and manage obesity. The presentation will also demonstrate different methods of nutritional assessments used and screening criteria for obesity worldwide. So, from this research worldwide trends, we found the underweight and obesity has risen significantly from 1990 to 2022, with notable increases in many regions. And these trends highlight the need for urgent action to address the public health challenge posed by obesity. While underweight also remains a concern in many parts of the world, particularly in low and middle income countries, obesity rates have just surpassed the underweight prevalence in many regions. We can see from the research, they also highlighted the role of food systems. So, food accessibility and security are influenced by national policies. Usually, low and middle income countries often struggle to afford nutritious foods, leading to higher rates of underweight and malnutrition. While in high-income countries, challenges arise of calorie-dense industrial foods, often high in sugar, fat, and salt, and this contributes significantly to the rising obesity rates. We can see also the increasing prevalence of obesity among children and adolescents is a pressing concern, as it leads to early onset of obesity-related chronic diseases such as type 2 diabetes and cardiovascular diseases. And early intervention is very critical to address the root cause of this childhood obesity to prevent the development of complications later in life. And these interventions should focus on promoting healthy lifestyle and addressing socio-economic factors contributing to obesity. And of course, the prevalence of central obesity has also increased from 31.1% in 1990s to 48.3% between 2010 and 2014. This alarming trend highlights the need for urgent action to address the root causes and prevent further escalation. All this happened likely due to the economic development and urbanization, fostering the obesogenic environments, such as dietary changes, physical inactivity and inactivity, and sedentary lifestyle. And central obesity is also more prevalent among Caucasian and African females over 40 years, particularly in high-income urban areas. This may be due to lower basal metabolic rate and also reduced physical activity. In economic factors, the development has contributed to the rise in central obesity. Especially younger individuals also alarming and highlighted the need for urgent preventive measures and early preventions to stop the growth. All this sedentary behavior, including prolonged smartphone and computer use and work-related stress. We can see from another research from World Obesity Federation shows that by 2030, it's projected that 1 billion individuals worldwide will be affected by obesity, with significant personal costs related to healthcare, reduced quality of life, and disability. Obesity-related healthcare costs are projected to rise dramatically, placing a significant strain on national economies and health care system worldwide. We need to call for urgent actions, including comprehensive policies and public health interventions to address the obesity epidemic. And now we come to this session, we'll try to explore what are the nutrition assessments that we have, how important and what are the impacts that we use here for personalized obesity management. How can we emphasize this importance of individual needs and preference using nutritional assessment? So here we can see the nutrition assessment is the foundations of personalized obesity management. We always wanted to put the individual at the center. With the nutrition assessment, it's actually easier to help identify dietary patterns which contributing to weight gain. And it also allows to personalize calorie deficit strategies, tailor all the strategy to ensure the individual have enough nutritional adequacy. And also this is helping support the development of sustainable eating habits. It's very important for long-term weight maintenance to reduce all these kind of obesity-related chronic conditions. This is very important. By using all this assessment, we can actually have a very comprehensive for the individual, such as effective weight management, assessing their BMI, waist circumference, and also waist to height ratio. And this is using the initial evaluations, can also explore the comorbidity and weight history, emotional factors, and the readiness for change. Not only that, but the nutrition assessments also very essential for influencing clinical outcomes and is also affected by individual factors. It can help to identify all forms of malnutrition, including undernutrition, micronutrient deficiency, and also overnutrition. A very comprehensive approach in nutrition assessment involves these four key assessments, which is clinical exams, anthropometry measurements, diagnostic tests, and dietary assessment with evaluations for underlying condition. So not single test can actually fully determine nutrition status, as the results are influenced by multiple factors. That's why it requires us to have careful interpretation. And this guideline, medical nutrition therapy in obesity management, has stressed the importance of tailoring nutrition interventions to individual needs, preference, and medical condition. I wanted to should promote this individualized eating patterns. We should develop their food quality and develop healthy relations with food. There's no one size fits all for managing obesity. Adults with obesity should consider a client-centered, flexible nutritional interventions to improve their long-term adherence to enhance health outcomes. They should consider various medical nutrition therapies by selecting dietary patterns that can let them sustain and have their long-term outcome. Next, we will see these different nutritional assessment methods that we use and screening criteria to assess the nutritional status one by one. So the first one will be the dietary assessment method. This is the most common method in nutrition research, including diet records, 24 hours recalls, and food frequency questionnaires are widely used in the nutrition research. And among this 24-hour recall is currently considered the most accurate method for assessing food and nutrient intake. So, due to the episode nature of food choices, we usually prefer combining methods to assess foods. So, beverage also, and also the dietary supplements. And for this, FFQ and screeners, usually we rely on the generic memory. So some of them will be easy to complete the questionnaire, but some of them might be difficult to memorize their diet intake. So all this is very important because it relies on the motivations, honesty, and memory of the participants, as well as the investigators' skill in interviewing and ensuring accurate instrumentation. So in this research, they also find that dietary assessment is very important because it's actually they helping weight management promotion, and it highlights the benefit of specific dietary such as the fats can improve the inflammation, gut microbiota, and metabolic health. The dietary assessment also stressed the value of understanding emotional and mindful eating behaviors. They can use the tools such as mindful eating questionnaires for maintaining a healthy weight. Of course, it will combine together with the rest of the assessment. The next one we're going to discuss is the biochemical assessment. So biochemical assessment of nutrition status is a lab-based approach that measures the level of nutrients in a person's blood, urine, or stool to evaluate their nutritional health. This test can help the healthcare professionals to identify nutritional disorders, monitor them, and guide interventions. Some common biochemical markers used in the nutritional assessments include blood glucose level, lipid profiles, and hemoglobin, serum albumin, and macronutrient levels. And biochemical assessments can provide objective data on nutrient metabolism and absorption. For example, low HB levels may indicate iron deficiency anemia, while abnormal lipid profiles may suggest dietary imbalance. So biochemical assessment, for example, in ALS patients called amyotrophic lateral sclerosis patients, is very useful because if depend only anthropometric indicators is insufficient to assess the whole nutrition status of this patient. So biochemical markers is valuable to identify early nutritional deficit, to monitor the disease progressions, and to guide targeted interventions. And now come to the anthropometry. Anthropometry is the very common methods as well. It's very widely used method to assess nutritional status of individuals or populations. It relies on the growth measurements and is actually non-invasive, cost-effective approach. This anthropometry assessment also include, for example, BMI, MUAC, which provide a very simple and convenient values for the assessment. Some studies also use skin fold measurement and then some used waist circumference, waist hip ratio, and by calculating the score of these measurements, the anthropometry result can provide a relatively accurate way to assess the nutritional status. So not only that, the behavioral intervention also necessary as weight management is a multifactorial. So stress and emotion also very crucial. Together with this anthropometry, together with the behavioral intervention, and also the dietary assessment, we can know that how can we improve the patient's nutritional status. How can we use all this additional information, including physical activity, the fitness level, and their ongoing medications to review any medication-induced weight gain to help the patient. Now, the anthropometry in pediatric is a big challenge. This is because in pediatrics, the review is including this DXA, we call dual energy X-ray absorptiometry. It provides a very comprehensive analysis of body composition, including bone mineral density, fat mass, and lean body mass. It's quite expensive. It's less accessible compared to other methods. Another one is the BIA, called bioelectrical impedance analysis, and also skin fold measurement. These two are cost-effective and readily available and easier for them to do, but it's actually less accurate to estimate visceral fat, and also might be influenced by factors such as hydration and also different body composition, especially children. That's why in this research, they show that it's very challenges in pediatric assessment because children, they always grow. They constantly growing and developing. So the changing body composition and growth pattern can affect the accuracy of the assessment tools. And children also prone to dehydrations, which can lead to inaccurate estimation. So still, combining all kinds of assessment is crucial to manage pediatric obesity and the related health condition to improve the outcome of the assessment. And clinical assessment is also very important because this clinical assessment involves a comprehensive physical examination that can identify signs and symptoms of nutritional deficiency or excesses. For example, this clinical assessment can enhance the understanding of an individual overall health by identifying specific nutritional needs. And healthcare professionals will examine their skin, hair, nails, and mucous membranes for signs like, for example, pallor, dryness, or lesions. They will also evaluate the patient's muscle and fat distribution, neurological function, and their eye for some signs of nutrient-related conditions. Now, the other one, the nutritional screening tool, we also evaluate this MSD, MUSD, and also MAA to identify patients in the hospital, especially how is their risk of getting malnutrition. So this MUSD and MAA, the accuracy is varies, with some excelling in sensitivity and others in specificity. So we must choose the right MSD to avoid misdiagnosis and unnecessary intervention. We must consider the specific patient population and the tool's strength and limitations when we make the decision to choose a nutritional screening tools. it's very effective if you can use it properly and suitable for patients' characteristic, especially some of the elderly. If they don't understand, you can't get the result that we want. For example, in stroke patients, in this research, the mass and MNA is showing very strong predictive value for functional outcomes in stroke patients. So early nutritional assessment and interventions are also very crucial to help stroke patients improve their functional recovery and overall health outcomes. And this study also recommends routine use of validated nutritional screening tools, MUSD and NNA, as a part of the standard care for the stroke patients to ensure early detections and management of malnutrition. And last but not least, I'll highlight this SGA as a reliable tool, because SGA is a semi-quantitative evaluational tool that can evaluate a patient's nutritional status based on their medical history and physical examination. It's a widely considered a reliable and valid tool for diagnosing the malnutrition and can predicting morbidity and mobility. It's a fully quantitative scoring system. I tried that before. It's actually very simple, is reliable and dynamic, particularly for elderly patients. And this form can identify patients who are likely to benefit from nutrition intervention. And it also involves identifying individuals whose they have inadequate nutrition intake or absorption as planned features of malnutrition, such as body wasting. So now come to the conclusion. These global trends in obesity present a very significant public health challenge, require urgent action. To understand all these environmental, behavioral, and socio-economic factors, we try to implementing all the comprehensive policies and promoting healthy lifestyle, then we can effectively mitigate the obesity epidemic and create a healthier future. By understanding all this importance and impact of different nutritional assessment tools and adopting the best practice for the applications, we can play a crucial role in improving nutritional care and promoting better health outcomes for all. And that's all for my presentations. These are the references. And thank you for your attention. Have a good day. God bless you.